Welcome to Chillin' 101. We hope this video helps.
You start by checking the bottle for concentration and directions because that tells you how often to apply. Once done, cleanse the area with mild soap and water. Pat dry thoroughly so lotion adheres. Measure a thin layer, about a film over the lesion, and apply directly to skin, rubbing until absorbed. Make sure to avoid eyes and mouth. If treating scalp, use fingers to work lotion into hair. This ensures contact with the infected skin beneath. You keep using the lotion at the prescribed frequency because consistent dosing kills fungus more reliably. After each wash, apply again to the lesion and extend treatment 1 to 2 centimeters past visible edges to catch microscopic spread. Make sure to let the area dry between applications. Moisture promotes fungal growth. If you have hair, move lotion into the roots. Continue the full course, even if symptoms clear early, so recurrence, you finish the full prescribed course to prevent relapse. Stopping early can let fungus return. Once treatment ends, inspect the site. If redness, intense burning, or spreading occurs, stop using the lotion and contact your provider. This may signal sensitivity or another condition. If the infection persists after the full course, make sure to follow up. You may need a different therapy or a prescription strength option. Remember, patience and consistency are the keys to success.
Thanks for watching. Consider subscribing if we helped you.